Hi everybody, my name is Kimberly. This is my axial skeleton video. First we're going to start off with the skull. So as you can see here, I have it labeled. We have the frontal, peritoneal, and occipital bone. The frontal bone is going to be in the front here. Lower the skeleton so you can see. This is the frontal bone. The temporal is going to be on the side of our skeleton here. Right here, temporal bone. The occipital bone is the back. The peritoneal is like the middle of the head. So the middle of the head. So that's part of the skull. Moving forward, the highest point, which is referred to as the ion, is near the middle of the squamous. Then we have our temporal, which is on the side. Like I said before, the temporal is called temporal because it's kind of like the temples. So it would be like on the side here, where like my glasses are, like the temporal. Those are the sides and the base of the skull. Those have the mastoid, the external acoustic meatus, and the squamous part. What is housed in the temporal bone is the middle meningeal artery. The internal acoustic meatus is a passage for nerves and blood vessels. So blood vessels and nerves, they pass through the temporal. The syphenoid is the bone in the sinus area. That's like the syphenoid is the middle of the skull. The supraorbital fissure passes through nerves. So your eyes, this is all like your eyes, your syphenoid, all this upper region of your face. So you can see here on the skeleton, it's a little bit easier to see on my face, but right here the orbital bones, the nasal cavity, it's going to be the mandible, the jaws, and then yet again we have our cheekbones here, you could see. The ethmoid is the square bone at the root of the nose, forming the part of the cranium. So that will be right here. The crista galli is the Latin name for the crest of the rooster, which basically means the plate of the ethmoid on either side of the cribriform. So that'll be like the sides of the nose. The small unmilitary axons are recipients of bipolar neurons that pass through the holes of the cribriform. So that would be like parts of the nose and stuff as well. The maxilla is the upper jawbone. So that would be above the teeth, like up here. That would be your maxilla. This part, the alveolar process, that is the thick rigid bone that contains tooth sockets. So the best way that I could describe that is if you were to open your mouth, like the inside bone, where the inside of like maybe where your gums is or are, that would be your alveolar process, and that's where your teeth are connected, your tooth sockets. And then the zygomatic is your cheekbones or your molar bones, which articulate with the maxilla. So everything obviously is connected. So your cheekbones, they articulate with the maxilla, which is your top jawbone here, which are all connected to your cheekbones and then your upper jawbone. The two bones that form the zygomatic are the temporal and the syphenoid bone. Ethmoid is like we said, the square bone at the root of the nose. So that'll be like the square part at the root of the nose. It's kind of hard to see. You can see right here, square point. The vomer is the small bone that separates the left and the right nasal cavities. So in your nose, you have your right side and your left side. So the vomer is the part that separates both of those. The two bones that form the bony nasal septum are the perpendicular plate of the ethmoid and the vomer bone. So those are the two bones that are created for the septum. And your septum is like a cartilage. The inferior nasal concha is an extended horizontally along the lateral wall of the nasal cavity. Your mandible is the strongest bone in your face, and that is your lower jaw. So all of this right here is your mandible. It's pretty big. Your jawbone is pretty big, and it's the strongest bone in your face. So this is the skeleton's mandible. You can see it on the side. And then moving on, we're going to go to the back. So I'm going to turn the skeleton around. You can see here the occipital bone, the syphenoid, which is at the very bottom of like where your occipital is. Your vertebral column is like aka your backbone or your spine. The vertebrae column is just the fancy name for it, and probably the technical term. Actually, not probably, it is the technical term. It has the two primary and are like the fetal. So when we're born, those are your two primary of your vertebral column before you grow into adult size and you get your two secondary. So the two primary are your thoracic and your coax. Your thoracic curve would be like your pretty much behind your your ribs right here. So it'd be like kind of like the middle of your back. And then the coax or whatever is closer to like your pelvic area. The two secondary, as adults, we get the cervical and we get the lumbar curves. The cervical curve is going to be located at the top, near like your neck. So it'll be up here towards the top of your neck, and then your lumbar is towards the bottom. The bottom part is where your lumbar is located. So moving forward, we're going to go to our ribs. On the ribs, the costal cartilage of each of the ribs is connected to the sternum. We have 7 ribs that are true ribs. Those are true ribs are actually connected to the sternum. Those are your sternum is your breastbone. So that's going to be all right here, all the top of the skeleton. You can see right here, the skeleton sternum is right here. On myself, my sternum is where my scarf is, It's going to be where like your collarbones are, all the way across your breastplate, all the way. So connecting your ribs are all connected right here. 7 of them are true ribs. 8 to 10 are false ribs. So those aren't attached to your sternum. False ribs are not attached to your sternum at all. And then 11 and 12, so 2 ribs, are only attached to your spine and your back. And those are considered floating ribs because they're not attached to the sternum at all. That's all that I have for the axial part of the skeleton. Thank you.